But before we get into our bills, our legislative package and more, we had a banner Kupuna year. So I'm really pleased with that. And we'll get back to that. I'm so pleased that we have Jeanette Kojani with Kokua Mau. And, you know, because we had Our Care, Our Choice that passed this year, it's very apropos that Jeanette tell us about her program, which is on palliative care. And she's done a lot of good work with pre-planning of these issues that we face at the end of life. So it's really my pleasure to introduce Jeanette, and she has some other people with her. But Jeanette, you want to take it away? Welcome.
Well, thank you very much. I'm gonna thank you so much for the invitation to come and do an update for the Kupuna Caucus. I have some slides so I can share those and kind of keep myself on track anyways. I'm checking that you can see them.
Yeah, we can see.
Okay, sounds good. So I will do a brief presentation and then very happy to take questions, and especially with this group. Like, congratulations on all the great work that's been done. And then again, please let me know how we can work together. So it sounds like somebody needs to mute themselves, but maybe somebody else can help with that. Okay, so Kokua Mau, there are two of us here today. My colleague Hope Young, who is the Advanced Care Planning Coordinator, is also joining us, and now you have the entire staff. So we are a small but mighty organization. So we are a statewide coalition that is really committed to improving care for people with serious illness. We are a 501c3, a nonprofit organization, and we are not a state entity, but we began in the Executive Office on Aging under the leadership of Marilyn Seeley, who may be out there at the EOA conference room. So we are still going since 1999, and we are a membership organization. So health plans, hospitals, hospices, all sorts of different folks are members of our organization, as well as individuals who keep the programs going. And we really rely on passionate volunteers around the state to help do the work that we do. And we look at a continuum of care. We start early with advanced care planning. So most of us, you know, people think, okay, what's an advance directive? Who would speak for me? Who would speak for me? Who's my agent in case something happens? We are the home of POLST in Hawaii, which is a very important program that we think needs to be very, continue to be very strong. Palliative care is something that we are that we're working on promoting, as well as hospice care and helping people understand how these two things are different as well as similar. And then bereavement, that is a really important resource and activity that we have as well. So we work with, we approach this in from three different angles. I'm a public health person, so I think about this from different angles. So we like to put people who may be facing serious illness at the middle of the work that we do. How do we help people who are facing serious illness and their loved ones understand decisions they may need to make and how to find resources there? And how do we start that as early as possible? So we have a very actively managed website that we hope you will use as a resource. We also have a free newsletter that people are welcome to use. And we have a speakers bureau. We call it the Let's Talk Story program, which goes out into the community. So again, the center of our work are people. And then the second thing we do is help professionals. How can we help professionals to do their job better through networking and training? And then finally, we look at policy and legislation. As you know, we didn't have any bills before the ledge this year, but we really have been looking at policy that can raise all boats and help everybody. So we welcome you to our movement for change. We understand that these conversations and making these conversations the norm will only happen if all of us are in it together. So I certainly welcome people to join our newsletter, learn more about what we're doing, come to events, but we can't make this happen without all of us and all of you. So in terms of our priorities, we have three things that are our top priorities. The first is advanced care planning, especially with underserved populations. And this is really important. And a lot of people really have never heard of advanced care planning. So how do we get out to different groups, talk to different populations to make that happen? I mentioned POLST, we're the home of POLST, and we think that this program must remain strong. We are actually in the process of updating POLST, so there's going to be a new and improved POLST soon, along with the 10 languages that POLST is translated into and the advanced care planning materials. So stay tuned for that. And then we really are committed to helping people understand what palliative care is and how to access it. So we do a number of things to do that. If you're wondering yourself, hey, what was palliative care? Please go to our website. We have links to videos and FAQs and things like that. I do want to say, I think the thing that most of us are most excited about is the hope that we will be the first state in the country that has a palliative care benefit that is approved by CMS for Medicaid recipients. Really kudos to our MedQuest team and the leadership there for not giving up and being committed to this. We are all very excited and hope this will be really a game changer. So these are the main things we work on. And thinking of all of you out there who are, helping Kupuna, helping their families, helping loved ones, please see us as a resource. So send people to our website. As I mentioned, we have materials in a wide variety of issues, or for a wide variety of issues, and also in 10 different languages. And we're hoping that the Chuukese translations will be available soon. So most everybody in the state sends people to us for advance directives. Great, please do so. POLST, same thing. As I mentioned, we have all sorts of good resources there. Some of them you've seen before, so please, these are all things that are free to download. We try to make everything free and not have any firewalls, just to make sure that people are able to access materials. One of the groups that we partner with, and we're sort of a super user for the Conversation Project. Again, a lot of times people have trouble figuring out, how do I start these conversations, or what do I say? So I thought I'd give you some examples. Again, you can go to our website, but how do I talk to my family? How do I talk to my doctor? There's a starter kit for people with dementia and Alzheimer's, how to be a healthcare agent. So this is an example of some of those free materials that we have that we want people to use. So the second thing we would say is that we want people to use our website, and we hope that you will think of inviting us in for a training. So this could be for your staff, the organization where you are, your office. If you're a part of a faith community, we do lots of talks with churches, Buddhist temples, Jewish temples. Like, we like to go out into the community. Book clubs, Alulike, all sorts of groups invite us to come. We have also, like, for instance, we've been partnering with EUTF since long before the pandemic. Hope is doing a lunch and learn in October, but we are happy and flexible to do things long before that. And the main things we concentrate on are advanced care planning, having conversations, making people more comfortable with these topics, and then what type of care options are available. So that's looking at, understanding what is palliative care, what is hospice care, what are the options that are available. Sharon mentioned the Our Care, Our Choice Act. We definitely do trainings about that. So we're, of course, interested in changes that are coming. Our website has good links to the DOH website as well. So again, please think of us as a resource. I think a lot of people know that these topics are really important, not exactly sure how to start. So we are happy to help with that. And then just two other resources, this has been a really horrific 3 years with the pandemic. Let's not, I don't think any of us need to be reminded of that. And there are groups in the state under the umbrella of the Bereavement Network of Hawaii who are able to and ready to reach out and help people. So that also lives on the Kupuna website, Grief and Bereavement Resources. Our last meeting was talking about some of these amazing people and resources that are out there. And then I put up this as a consumer advocacy or consumer support. The last one is thinking about mortuaries and funeral homes. This is a recently updated price list. One of our volunteers heroically called all the mortuaries and funeral homes on the islands across the state. This can be a super expensive thing for people, and there's a lot of buyouts going on. So I can tell you this is one of the most visited websites, that web pages we have for social workers who are trying to help families. So this is just some of the examples of some of the work that we're doing in this space to help people with serious illness and their loved ones to not have as much stress, to avoid crisis, or if they're in a crisis, to find the resources that can help them. So we hope you will join our free newsletter. That's really the best way to find out about both local and national resources, webinars, seminars, all sorts of things. As I mentioned, send people to the website, use the translations, and invite us to come and talk with you. You can send us a chat, something in the chat room, or send us an email, because Hope and I are happy to talk to you and strategize about, ways that we can work together. I guess in my job as executive director, in case you have any ideas of unspent monies or rich people who want to do something useful with their money, please let me know. That's an ongoing challenge. But really, seriously, we look forward to partnering with all of you and seeing how we can work together to improve care for people across our state. So happy to take any questions.
There is a question in the chat. Diane is asking, what are the changes that will be made to the polls?
Oh,
Thank you.
Before you do that, can you tell us what POLST is?
Oh, sure. Okay, then. So for those of you who don't know what POLST is, you can easily go to the Kupuna website. Good information there. POLST, you may have referred to it before as the bright green form. This is an out-of-hospital order that is a conversation with your provider, and it documents what the care plan is when you are not in the hospital.
And what does it stand for, Jeanette?
It stands for Provider Orders for Life-Sustaining Treatments, POLST. And thank you very much. Kendi just put the link in the chat. So please go and look at that. So people say, oh, the bright green form. Many people in Hawaii refer to it as the bright green form. It is specifically for people who are quite ill, who are frail, who are have very serious disease, and where you want to have extra, you want to have orders that EMS can follow. So if EMS comes to the house, they look on the refrigerator and they can follow the orders that are listed there. EMS can't honor an advance directive because it's not a medical order. A POLST is a medical order signed by a physician, an advanced practice nurse, or a PA. So we are happy to do trainings on what POLST is, and we send you to our website, and we're happy to help out. But this is a super important program. As one of my colleagues says, it's a really important program, and we, Kukuama, we are the kind of the keeper of POLST. DOH is a partner, But we get zero money from the state. So it's an unfunded mandate that we have taken on to make sure that it carries on.
Well, thank you, the two of you. Hope that
Well,
Thank
we have a
all
whole
of you
bunch of other
and
people.
beyond and beyond.
And-
But can you also answer the question, are there any changes that that have recently been made that
Yes.
we know
And
about?
thank you, Diane, for that. And what we're going to do when we're ready to introduce that is we'll have a webinar. I think Dr. Daniel Fishberg and Dr. Libby Char will be the star speakers for that one. The main things that we have done is try to improve the language a little bit, trying to make it clearer for people. And then, so it's not major changes, Diane, and I'm happy to, when we're there, we'll send them to you. But the main thing is we want people to understand, how do we make it clearer? And we also added in that now physician assistants are able to sign a post. So
And
it's mostly clarity of language.
what is ACP? Can you explain that?
Advanced care planning. Sorry.
That's what you do. Yeah.
Advanced care planning is that's the insider speak for thinking and talking ahead of time about, two main things. The first thing is who would speak for you if you couldn't speak for yourself. So that is appointing a healthcare power of attorney or a healthcare agent. Like Hope likes to say, who are your people? Who would show up for you? And it's very important that we do that. And, and anybody who works with Kupuna knows the problems with not doing that. And then the second part of advanced care planning is talking about what matters most to you and making sure your wishes are conveyed to those people who will be speaking for you if you can't speak for yourself.
So Hope, can you also put on the chat the website where people can get all this great information that you folks have put together? So are there any questions from any of the other members? Do I see any raised hands or?
So Hope and I are going to stay on the call because we're also interested in the changes. So please
Sure,
feel free
please.
to, to write to us, write, text, send a carrier pigeon, whatever we're doing these
Mhm.
days. We are very happy to work with folks. And I think, most people know the importance of this, and we are people who will run, we run towards this fire, that we are happy to help with these issues and help to start the conversation and hopefully to prevent crisis, because we certainly see that over and over again, that families who haven't had these conversations, it can be very traumatic and difficult. So we're all about helping people as we can.
Well, thank you very much, Jeanette and Hope. I mean, it's all the work that you've done and for very little that we fund you. So you're welcome to join this organization. Maybe you can bring in some of your programs as we go forward, and we may get you more limelight at the legislature or some possible funding.
Yeah, as I said, in case there's any money sitting around, just let us know. But no, seriously, for us, the engagement of certainly this group, many of whom, looking at the names I do know, that's the way that this continues to work since 1999, that Kukuamau is going strong.
Okay, great. Well, thank you for all your work.
Certainly.
Okay, so we are going to move on now to the legislation. When I see, my co-convener, co-chair, Representative Troy Hashimoto is on as well. So we're going to go over the final status of all the bills, Kupuna Caucus, and those related to Kupuna. So we have that up here. And we had a banner year, I must say. So thank you to all of you for all your support and testimony, because that all helps. And hold on, sorry. Sorry about that. So we have 3 out of the 5 in our Kupuna package did pass. So let's just go over all of them. HB 898 was the Kupuna housing bill, and we asked for funding for rent supplement for our kupuna so that we could prevent them from being homeless. And we got $1 million to HPHA, Hawaii Public Housing Authority, to provide funding to kupuna who need the rent supplement. And we hope that we can keep it going for the following year. It's for the coming year. And Troy, Rep Hashimoto, you can chime in anytime. He's the housing chair, so he did a lot of heavy lifting for a number of bills related to housing. SB 900, that's our SHIP program, State Health Insurance Assistance Program. We did have the 3 positions that we requested, plus $186,288 for it. That passed. And so they can expand their coverage. Hopefully, also the neighbor islands can get the same kind of support to get information. And Caroline, you can chime in anytime. These are EOA programs. House Bill 650 also passed. This is the Our Care, Our Choice. And as you recall, it is including now the APRNs to help in the assessment and authorization and counseling, and also reduces from 20 days to 5 days the mandatory waiting period, and waives it when they're assessed to be terminally ill and not expected to survive the waiting period. So that finally, thanks to everyone's help, got through. The 2 bills that did not get through was the healthcare facility inspections. All of these that did not get through, more work to be done in the interim as we look at what the problems were and overcome them in the next iteration of the bill. And the last bill, SB 652, relating to workforce development and support. Caroline, are you on? Is Caroline on?
Yes, Senator.
Oh, okay.
Hello.
Yeah, I want you to join me in why we deferred this measure based on a lot of funding that we have in other places. But do you want to tell us about it a little bit?
Yes, so I think that was part of the reason. And aloha, everyone. Caroline Cuddy-Rao here with the Executive Office on Aging. I would like to add, though, on this that we do have some workforce development monies from the federal government. So we are going to be looking at how we can move some of the items that were written up in this measure forward. In fact, we had a meeting yesterday. I know Mari Carr's on too, and we're going to be looking at that again. I think taking a step back, looking at what are some of the low-hanging fruits and what we can move forward. But again, an area that we are still very interested in and that we want to move forward.
Thank you. And I might add that the Department of Labor and Industrial Relations has some internship monies that are available. Also, the community college has a big federal grant, and healthcare is one of the priority areas. So the idea is also to coordinate with them in the coming interim to see how we can build on each other, and what is not being done, then come back next year if we have to. So I think that was the intent in deferring, not that it isn't important, but that there are other kinds of streams of money that we could use and see where we are after working together on what is prepared for various areas of kupuna care, healthcare. So Caroline, you want to say anything more about SHIP, or since you're on SHIP, or the Medicare Patrol?
Yes, If it's okay, Senator, I'd like to just share with you our two administrative measures that,
Oh, yes, okay, wait.
and then I can,
Yeah, why don't we go to?
or should we go through the list?
Yeah, just finish the two, if you have anything to report on what it's going to do for SHIP and what it's going to do for the Medicare Patrol, and then we'll move to the other related measures, which does include what you.
They're right there. in
Yeah,
fact.
yeah. So tell us a little bit about what the three more positions are in both programs and what they're going to do.
Okay, so again, thanks to the legislature for supporting our two programs, both Senate Bill 900 that we just went over under the Kupuna Caucus measure that provides for 3 full-time equivalents for the State Health Insurance Assistance Program. As most of you know, that program has had 2 full-time equivalents, temporary positions for the last 30 years. Over this time period, our Medicare population has grown by almost 300%. So these 3 positions will help us to continue to expand the State Health Insurance Assistance Program to provide the unbiased education and outreach that we need to do. And with our State Health Insurance Assistance Program. The second one, Senator.
Caroline, is that going to be still based in Honolulu, or are you going to help the neighbor islands? How does that work?
Oh, it's always statewide. It's
Oh,
always been
statewide.
statewide,
Okay.
yes.
Okay,
Mhm.
good. Okay.
And similarly, the Senate Bill 1592 for the Senior Medicare Patrol also is for 3 FTEs and the funding that goes with that for the Senior Medicare Patrol. And that is to go ahead and continue to expand the education and outreach around frauds, scams, Medicare billing errors, making sure that people get the help that they need with that. Again, both programs are volunteer-based programs also, so the additional staff will help to increase our reach, to spread word about volunteering for these programs. And again, a lot of just outreach, education, expanding on our whole DEI effort for diversity, equity, and inclusion in both programs under the Biden administration. So we're really excited because this is just going to allow us to finally expand where we need to. The need is there. The population is there. This will just help us to expand those efforts.
So Caroline, on the Medicare Patrol,
Mhm.
when they find fraud, what happens? Do they get, does the AG help, or how do they go after these bad people?
Well, there's all different types of fraud too, right? So on the Medicare fraud, when they identify billing errors, and I'm actually going to ask Norma in a second to speak, but when they actually find billing errors, they'll work with the Office of Inspector General for those Medicare billing errors. And I don't know, Norma, would you like to share how you guys have diverted some of the calls that you got into the office on people that have been scammed without divulging personal information? Thank you.
I don't want to sound a broken vinyl, but mahalo piha to our legislators, everybody, all of the people who have stake in this wonderful, fragile, precious, unique community of Hawaii to protect not just Kupuna, but their ohana and caregivers. When we're talking about Medicare and Medicaid scams, alleged or actual, this may involve billing errors or outright abuse. What this state funding will allow us to do, because we've been 2 people for 25 years, it will allow us to not just pivot now and refer alleged or actual non-healthcare scams, fraud, and errors to the agency that would be more appropriate to address. It will actually help us, Senator, be a little bit more instrumental in helping Kupuna resolve that, i.e., or e.g., romance scams, gift card scams. Right now, we do the referral, and all of our different agencies, whether it's Federal Trade Commission, Commerce and Consumer Affairs, Attorney General, Criminal Justice Division, et cetera, the FBI, HPD. Right now, they know us, and we have that fluid relationship, but the state funding will definitely allow us with proper training from staff, for staff, to actually help even more with these. But then again, we'll be always achieving mission effectiveness by addressing those healthcare scams. Now, all of the 54 chapters, they pretty much focus on Medicare fraud, errors, and abuse. We're one of the few chapters, Senator, that is actually working on the Medicaid side. We had the fraud control unit liaison Landon Murata speak to us and train us last month. So we're going into that. And one more thing, you know, DEI, diversity, equity, inclusion, we think we do that in our sleep anyway, born and raised in Hawaii, right? But in doing this grant that we had last September and ending next February, Senator, there's only 5 chapters that were awarded or named DEI grantees. This is the first initiative, formal initiative for ACL to grant us monies of $150,000. What this DEI has done for me personally, it has really sensitized me to the gaps and barriers we all have. I mean, race relations in Hawaii is tricky. So it's just really trying to look at where our volunteer team is. Is it kind of reflective of our society here? Can we transform it? How do we become culturally humble? How do we get sensitive to all this? From Haena to Hilo, from Pupukea to Pahoa, to Hawi, to Honau now. So I think it's important for us to really recognize the good work of the last 25 years, all of the leadership and management, and especially to the people of Hawaii who are most vulnerable. Thank you for submitting your testimonies because your voice is heard, and thank you to our legislatures.
Oh, thank you. Thank you for your hard work, the two of you. And if people don't know, can you put your in the chat your contact of if somebody sees fraud or sees a senior that has need of help, where is the best place to contact you? And people will then have that, so you get more calls now that you have more people coming on board.
And Senator, we'd also be happy to put in our call hotline for the State Health Insurance Assistance
Oh
Program.
yeah, could you put that, put that
sure,
on
sure.
screen?
Thank you.
So that people know. Okay, so it's yours again, Caroline. So-
Thank you. Okay, and the other two that I wanted to highlight and so excited to share with you is now Act 18, which was Senate Bill 1372, which allows us to, so what Senate Bill 1372 did was allow us to clean up some of the language in the definitions under the Kupuna Care program. When we merged the program in the last legislative session, there were some areas that we had to clean up. Also, it included both the working caregiver, and caregivers, just our natural support caregivers overall. So, and also included some services and supports for our caregivers. So we're very happy the governor signed this into law on April 19th, 2023 as Act 18, the 18th bill to be signed into law. Exciting.
Yay.
Yeah, so very happy for that one. And also Senate Bill.
Oh, wait, hold on. I don't know if Diane
Oh,
has her hand up. Is it on this or something else, Diane?
Oh, I can't wait till she's Paul.
Oh, okay. All right. She
I am
has,
so
she has a
glad.
couple more. She has a lot of wins this session.
I'm so grateful. And then Senate Bill 1373, waiting for that one, but that has been adopted, and that is for our administrative claiming special fund. We are now including in that to expand that to both our long-term care ombudsman program and our state health insurance assistance program for when they, again, this will need to be set up and applied for, but allowing our special fund to include those programs so we can draw down Medicaid administrative claiming funds. And again, that's a work in progress because we have to now start working on that. But that will be something that will bring in additional funds to support both those programs. Right now, our special fund, before this was adopted, just supported the Aging and Disability Resource Centers for when they provided support to those on Medicaid. So I just wanted to explain what those changes are in the administrative claiming fund.
So Caroline, these are all programs that the feds will then fund, or they include in what's fundable, or how does that work with the claiming fund?
So what it is, and we have to go through the study to see and setting up all of that, but for the administrative claiming, it's work that's being done on behalf of Medicaid beneficiaries that is considered claimable to CMS, and then we will be reimbursed for that work that's being done. And Judy could probably correct me if I got that a little wrong, but that's the gist of it. So again, we're going to have to set up that as far as it relates to both SHIP and the long-term care ombudsman. But
What about the Medicaid patrol? If they're expanding to Medicaid patrol, that would be fundable as well.
that right now, when I've looked on the CMS website, is not one of the fundable programs, but again, this allows us to bring in Medicaid administrative claiming for those other two programs.
Do you get totally reimbursed, or is it a portion, or how does that work?
It's I'd have to it's been a while. I have to go back and just double check, but it's based on work that's already been done and then being reimbursed for it. And I'm sorry, I don't have the rate study in front of me for that right now.
But we do get reimbursed for what we do and what we
Right,
charge.
that's what that, right.
Okay, good. So that's like double our money.
So we're excited for that one too.
Okay. And then we already covered the Medicare patrol. It was not in the Kupuna Caucus package, but it kind of slid.
Correct,
in. We slid
Oh,
it in.
and Senator, we can't forget the Alzheimer's.
Oh, yes. Well, it's coming here. And
Okay.
we were so successful. We had so many. This one is a big
Yes.
one. HB 278. This is the Alzheimer's public health campaign. And this was a big win for us because the campaign really is to, it was $1 million. We thought was over 2 years, but we have $1 million, I think, per year. If I'm not mistaken, right? So we really should do I think it was $1 million.
Hey, Senator.
Oh,
It's
Ron.
Ron.
There's Ron.
Hi.
Yeah, Ron should know.
How are you?
Ron.
Hey, Senator. Yeah, so it's a $1 million appropriation for the upcoming fiscal period. So 1 year appropriation effective July 1st.
Just for 1 year then. So,
Correct.
yeah, you asked for 500,000, yeah. So it's all in 1 year. That's what it was, right?
That's correct. Yeah.
So
So yeah. So thank you for the support, Senator Representative.
work fast and do a lot more research on some of the new drugs that are coming out too. Yeah.
Exactly.
Okay.
Yes.
Yeah. So do you want to add anything more on what you plan to do with all this money?
Oh, I'm sorry, Senator. Yes. So we're going to have to, of course, procure for this, but we really want to move forward these efforts for that education to really, and it's really going to tie into a lot of the objectives that we have both in our ADRD state plan, Alzheimer's disease and related dementia state plan, as well as the efforts, supporting the efforts on our building our largest dementia capable grant that we're hoping to receive from CDC. We applied for implementation grant, so we should know about that around September, and I can report more on that. But those are all tied together, and so it will really help to, I think, provide that education and awareness to just raise that bar, raise that heightened need in the community around Alzheimer's disease and related dementias.
Thank you. Thank you for that big emphasis on Alzheimer's, because I know that it's taken a while for it to take. And, finally getting an Alzheimer's coordinator in your office and this big spurt of informing the public, I think is really critical, because a lot of people quietly take that problem on, but now being able to educate beforehand and how you deal with it, I think will help the community, immensely. So thank you. Okay, Anything else? Okay, now I'll go back to Diane. Diane, you still have. Yeah.
Thanks. No, I think you guys actually answered my question. I wanted to find out about the Kupuna Care funding. So it looks like we weren't able to make Kupuna Care whole again, huh?
So Caroline, it's in the budget, right? Or what is in the budget, Caroline?
So, right, so Diane speaking to House Bill 1486, which I think got to
Yeah.
conference. I'm
Yeah.
not-
Yeah, it was,
So-
it didn't pass, but then
Right.
we put it in the budget, or what did we put in the budget finally?
I'm waiting for the budget worksheets.
Oh, okay.
But I do want to state though that we are still spending down some of our remaining ARPA funds. So for this next year, we should be okay. What I'd like to add though, that House Bill 1486 would have brought our budget back up to that 9 million. That's what Diane's talking about. So we were asking for the 1.8 million in there. We had taken a cut during the COVID pandemic. And then that would have brought our base budget back up to 9 million. And that's what Diane's speaking to. So yeah, that one did not pass, but something to be revisited in the next legislative session.
I know a lot of things in bills, you know, this year was a crazy year in terms of new people, new budget chair in the House. And I think a lot of things were put in the budget. But then, you know, again, because it took so long this year, we have to wait and see what actually came out. I don't know if Troy, Rep Hashimoto is on, whether he knows anything about that in the budget. Troy, are you on?
I'm not familiar on what exactly was in there. So I know there was the other one about healthy aging as well. So we'll have to wait and see. But you know, I think, and that's why it's important. Like, I think if it's truly important, we should probably just put in the Kupuna Caucus package, because then we can keep track of it, right?
Yeah.
And then we know it's a priority, because I think the ones that didn't have a really good shot, it was stuff that wasn't in Kupuna Caucus, right? So I guess the admin would have to keep track of it, but it's not us, right? And so you just got to remember that we like to look at the whole thing. But our top priorities will always be, what is the Kupuna Caucus? Because they'll ask us, right? You only get so many asks, and they'll be like, well, what's your top priorities? And we'll have to like go for the stuff that we know we set out. So keep that in mind. So if we think it's like really important, we should put it at the top of our list. And maybe the money ones we need to possibly combine too. And so it's easier to keep track of. Because at the end already, it was hard. It was just too many moving parts and too many things that we were trying to get. And we put a lot of stock into getting Kupuna housing. And so, you know, I think we've got some good stuff. It's just a matter of, I think we're getting better and better at coordinating.
Yeah, I think, yeah, to echo Rep Hashimoto, it really is hard because you're competing in so many other priorities. We really did want to get housing for Kupuna, so that was top of list. But you know, when you look at the whole list, especially the money asks, it's hard as which do you put up, and you know what can take with our colleagues as well. So I think with Kupuna Care and getting the funding in the budget, since it's already in the budget with EOA, it's a matter of whether it was increased or not, and we've got to see where the budget is at the end of the day on that. But a lot of the others were new and expanding programs. We were surprised, but we pushed, and we got even the Medicare Patrol, which was, you know, not on our Kupuna package list, but really was really lodged next to SHIP. It was like part of the same program. So we were lucky in that we got support for both programs, full funding. So I think that shows you how important it was to get objective information out there and help to the Kupuna who really, you know, don't have access to much information. So I think, yeah, that's I think where we saw a lot of the support for Kupuna programs this year. But yeah, I think Troy is saying what we should do next year. We learn every year how to get better and better at this, that we have only 5 bills that they will see as a package, and it comes from all of you. And we're seeing as a priority of our 200 plus members. It makes a difference to then go in with top priorities that we see really important for the session that we get them through. So Caroline, you wanted to add something?
Yes, I just wanted to add, I think the one missing from this was the Healthy Aging Partnership, which is also didn't make the cut. But that, like you said, Representative and Senator, that it could possibly be in the budget. We just have to wait because, yeah.
There's a lot of shifting around at the end.
Yeah. So, we're just waiting on bated breath.
Yeah.
For that.
I think that we tried to get as much into the budget if the bills weren't going. And it's at the end of the day, you saw the rush at the end. So hopefully it it made it in. So yeah, but at least you have your line item, and you've got ARPA funds to carry you over so that we can look when the dust settles, we can see where we are.
Yes.
Okay. Are there any other questions, comments? So that was, I think it was a really good year, I must say. A lot of funding came through for our programs that have been, well, like both your SHIP and your Medicare Patrol having only two staff, for all that time. Well, the Ombudsman had 2 staff as well, right? With contracted out. So I think that's really going to help a lot in the future. And maybe from that and from all of you, we can see where we go next year and build on what successes we've had this year. So Rep. Hashimoto, you want to say anything, add anything?
I don't have anything particular on the bills to add, but I think I will add that we did get additional 6 million in rent supplement, so that will help just generally speaking. I think that's a good thing. I think what the challenge is going to be, and I've told this to the money chairs, is when you invest in rent supplement and even the Kupuna rent supplement, it's almost like it's a long-term investment, right? Because people are going to start relying on this. And so I think what everyone's going to have to do is you're going to have to say, okay, well, we started this investment and we can't easily take it away, especially with the conditions that we're going to see, which is there's going to be a lot of people on the brink of rising rents, right? And being pushed out of where they live. So I think that's something everyone should consider to keep in mind. I think it's a great program, but I think it's only 1-year funding, so that concerns me a little bit. So everyone should be aware of that. And then I think at least we can put our care, our choice to be done with. We've been pushing for a couple of years, and so I think that's a good one. We finally were able to make everything aligned. So that was a really a good one. So I think overall, I don't think the Kupuna Caucus has anything to complain about. I know we might be sad about certain funding bills, but I think that we can hopefully we can get through. Caroline said, hopefully there's some ARPA funds that can carry us, and I think they were looking at some of that as well when crafting the budget. So I think next year, the FY25 year, is going to be the key year that we may consider focusing more on the money bills more than anything else.
So anyone else with questions, comments? Was Judy Moore Peterson on? I thought I saw her earlier, but if she were, there was also long-term care issues on community-based services that there was a bill that now increases fees for them. I don't see her on. Okay. She was on earlier. And Marika, I see Marika from Department of Labor on. If you have anything to say about the workforce training program and what we were going to do in collaborating so that we do have the training in long-term care and health care for our Kupuna.
Hi, Senator. Hi, everyone. I think the director will be speaking as part of a panel on the 12th, and to help share some of the laws around addressing the shortage in healthcare. So one of those is really part of the U.S. Department of Labor have a program of, it's called Foreign Labor Certification. So that foreign labor certification is employers can apply and submit an application, and they can bring in workers for 3 years, assuming, of course, that it meets the determination for the criteria under U.S. Department of Labor. So he'll be sharing more of that on the 12th. And in addition, I think we still have the internship program. So we're placing interns in various state agencies to expose them to occupations and hopefully fill some of the vacancies. So it's not so much the addressing just this, but the whole workforce needs in general.
And there's funding, yes, for training as well.
Correct. And then for employers, we do have the incumbent worker training where, they can attend any of the training that's available. And the list is on our website, and I can put that in the chat box.
Thank you.
That way they can go to training and we pay 50% while the employer pays 50% of the tuition.
Okay, so is there anyone else with any information, announcements? Well, I think then we will ask you for future topics that you want to share with us. And there's a lot of programs that have been funded. We hope that we can get some feedback and some presentations. And please feel free to email either Rep Hashimoto or myself or Charles. Kathy, you have your hand up.
I just wanted to remind everybody that May is National, Older Americans Month.
Oh, yeah. Is EOA planning anything, Caroline? Do you want to make that announcement? Or Kathy, you're shaking your head, so you know you want to.
Well, we have our celebration June the 2nd. It's 15 Craigside, and all of the islands bring their honorees. There's a male and female from all islands, all 4 counties, and we have luncheon and presentation for them there. It's a big deal every year. Past 2 years, of course, was virtual, but before that, it's been a big deal for years and years.
I know we're trying to do something in May for Older Americans Month, but I think during the pandemic, we kind of put it aside and we've, Caroline, you have to take the lead on that.
Senator, I do have to thank Kathy because the last 2 or 3, did we do 3 virtual events or was it 2? 2 over the last 2 years, where we honored our honorees from each county and we did it virtually. Representative Hashimoto, Representative Takayama was our MC. I think you can still get it on possibly YouTube, right, Kathy? We haven't every year. That's always, even during the pandemic, we made sure that we honored our volunteers. And like Kathy said, we're going to go back to in-person. This is a by invitation event that is really an event by the Policy Advisory Board on Elder Affairs. And they take the lead on this, and grateful for their support on that. And we look forward to reconvening after being on the hiatus of doing the virtual events.
Because we've had so many Kupuna bills, I'm just wondering whether we should have a governor signing. I don't know we tried to coordinate last time with long-term care ombudsman, but something like that, Rep. Hashimoto and I could ask for, or you can ask for a signing where you could bring people together, whether it's on June 2nd or another time earlier. But I think we have a really good year for the Kupuna, and would bring people together and sort of elevate this from Alzheimer's to SHIP to some of the rent supplement program. It's all good for Kupuna, and I don't think we've ever had so many bills and
I
funding.
think the last time may have been 2017 when the Kupuna caregiver bill got signed into law. I think that may have been the last time. So yeah, that
So why don't we
definitely.
plan on doing that, at least bringing people together May or June. That could help with celebrating older Americans Month.
Yeah, actually though, I mean, we will put in a request for for bill signing out. We
Yeah.
usually do that.
So you see all of the bills that we
Mhm.
have passed, and
Right.
plus your budget. I think
Mhm.
you might want to put that together. We can send you our screen share thing, and then you can work off of that.
Great, thank you.
Okay.
And Caroline, I can touch base with you on what we do for apprenticeship week. And at the end of the week, we highlight it's kicked off with the proclamation. So you could have it that way too. So we'll touch bases offline.
When is your apprenticeship program one?
November, Senator.
Okay. All right. Good. So anything else? Any other announcement, comments? I think that's good. Okay, well, then this meeting is adjourned. Aloha, everyone.
Aloha, thank
Wait,
you.
the next one will be June, first week in June Friday. So if you have anything you want to share with everyone, please send it to us. But thank you, everyone, again, for all your hard work. So without you, we wouldn't have gotten all of the bills that we did get passed. So mahalo, and thank you, Jeanette and Hope, for your presentation.